Welcome back to another episode of MedCity FemFwd. I'm Marissa Plescia, reporter for MedCity News. In this episode, we're joined by Dr. Renee Wittemyer of Pivotal Ventures and Dr. Regina Dugan of Wellcome Leap to discuss a recent $100 million commitment from the two organizations to advance women's health research. Hi, Renee and Regina. Thanks so much for joining MedCity FemFwd.
Thanks, Marissa. Great to be here.
Yeah, likewise.
Yeah, of course. And maybe just to start, Renee, maybe starting with you, can you just tell us a little bit more about yourself and the work that you do at your organization?
Sure. Yes, I work for Pivotal, which is a group of organizations founded by Melinda French Gates that is focused on social progress. And so I am the VP of Program Strategy, meaning that I oversee our philanthropic programmatic work. A little bit of background about myself. I am a social scientist. I've worked in a lot of developing countries around the world, listening to people's stories, and really working at the intersection of gender, tech, society for many, many years. Came to Pivotal about 9 years ago and have been leading all sorts of different strategies for Melinda since then.
Thank you, Renee. And Regina, how about you?
Well, I think I'm the nerd in the group here. I'm an engineer by training, but I've been doing work across many different disciplines, this latest at Wellcome Leap in global health for a decade, more than 1 decade now. I am currently the president and CEO of Wellcome Leap, which is an organization that was stood up by the Wellcome Trust in the UK with the goal of increasing the number of breakthroughs that we have in human health and doing so faster. So in 2018, the Wellcome Trust looked at their many years of work in global health and asked the question, has too much of our work gotten too risk averse, too siloed, too slow? And is the way we fund the work partly responsible for that? And so they created Wellcome Leap in that spirit. We've been underway now for 5 years with, I think, really good early results to show.
Yeah, that's really great. And Regina, bringing it back to you, your two organizations just recently announced a partnership to commit $100 million to women's health research. Can you tell us a little bit about what you're investing in and what you hope to achieve in this partnership?
Yeah, of course. So the $100 million partnership between Wellcome Leap and Pivotal is devoted to 2 new programs to try and generate breakthroughs in areas of women's health where women really are suffering with either morbidity issues or quality of life issues. The first program that we intend to launch is on women's cardiovascular health. Cardiovascular disease, still the #1 killer of women. And we still think of it as a man's disease. That's obviously not the case. The second program will be devoted to either autoimmune or mental health issues that disproportionately affect women. And with these 2 new programs, that will bring our total investment to $250 million. We have 3 ongoing programs, $250 million invested in women's health.
Wow, that's awesome. Renee, is there anything you'd like to add there?
I would say that, we met Regina probably 18 months ago, almost 2 years ago, and just have been so impressed with Wellcome Leap's approach to R&D and thinking about breakthroughs. And for this topic, this has been a topic that Melinda has been focused on for many decades. Like, this is part of her career and life's work. And we've just been thinking about what can we do in the space of women's health to really accelerate the timeline for change. And women have suffered for too long without the best approaches, the right solutions to the chronic illnesses that they face, and all of these things that Regina described. And so we really wanted to partner with her to deliver these breakthroughs in an accelerated timeline. And so that is like the crux of why we wanted to partner with them, and why we're so excited about the partnership.
I think we share, just to echo that, Renee, we share a real appreciation for the urgency of this. The time for incrementalism is over, right? We need urgent advances in women's health, in breakthroughs for women's health. And precisely the way we do our work, I think, is where we find the match. We just think it's not okay. This underinvestment and the lack of progress in advances for women's health, we've just got to fix it.
Yeah, very well said. I also want to follow up on something you mentioned about how you're starting with cardiovascular disease and autoimmune conditions. How did you go about choosing those areas to invest in?
Renee, do you want to start?
Sure. So Regina mentioned this, but women, as you know, Marissa, and have worked in this space for quite a while, women experience these health issues disproportionately and uniquely. And there's just little research on how to prevent, to diagnose, to treat these conditions. And so we are really interested in looking across the lifespan of a woman. And as Regina was saying, looking at spaces where women experiences these things differently, like cardiovascular disease. It's a space that presents differently in women. The symptoms are different than men. They experience this because of biology of a woman's body, or the idea that women are experiencing health issues disproportionately, and that these things like autoimmune issues are predominantly affecting women. And so that was really at the crux of thinking about, like, how are women experiencing these things differently, disproportionately, and uniquely, that only affect women: reproductive health, breast cancer, endometriosis. So those are the types of things in our mind that we've been thinking about. And we just had this synergy with Regina and her vision of how she's thinking about this. So it was like this beautiful partnership.
Yeah, thank you. We have 3 ongoing programs, Marissa. And so some of the conversation we had is what would be complementary to those programs. And particularly, I think Melinda and Renee, very interested across the whole span of life for a woman. So cardiovascular and autoimmune definitely fit that category. I think, autoimmune experience, 80% of the autoimmune cases are experienced by women. And there's something fundamental there. If you look at the amount of vascular remodeling that happens across the course of a woman's life, whether we're talking menstruation or pregnancy or even menopause, it's not difficult to imagine that the vascular system, in particular cardiovascular health, would be affected differently by all of that remodeling across a woman's lifespan. So cardiovascular is another space where we were really interested in pursuing new alternatives and advances for women.
Yeah, very well said. One thing we've spoken about a lot on this podcast is that oftentimes women's health is kind of just equated to being about reproductive health, and that's where a lot of the investment goes. But what I think is interesting about this investment is that this clearly targets other areas outside of reproductive health. So is that part of your thinking at all as well? Maybe Renee, bring it back to you.
I can say for Pivotal and Melinda, we've been thinking about health and well-being in this very expansive way, across the lifespan of a woman, and also including both the mental and physical health of women and of their families. And so we have been investing in this space, really thinking about what does that look like for philanthropy? What role can philanthropy play to catalyze new ideas, catalyze breakthroughs, really support work on the ground that is happening, not just in reproductive health, but seeing that as part of the bigger picture, and a very holistic perspective on that.
Yeah, I agree with that. I think part of the way we think about it also is that for so long, research has treated women as if they're small men. Right? Women are not small men, right? So health affects them differently, disproportionately, and uniquely because their biology is different. And I very often will talk about how that manifests. I'll just give you an example. 99% of the studies on the biology of aging do not include a model for menopause. Now that's just unacceptable. Half the population goes through this transition of life. So how can we not include the effects of menopause in the biology of aging? And there are countless other examples that look just like this. Heavy menstrual bleeding is a condition that affects 1 in 3 women. And if we were bleeding from any other part of our body to that level, we would call an ambulance. Most women wait for 5 years to get help with heavy menstrual bleeding. And we have very few options to offer them. Either we can shut down the reproductive cycle or we can remove their reproductive organs. For a condition that affects more women, 1 out of 3 women, more than those in their reproductive years who are affected by asthma and diabetes, that's just not an acceptable level of options for them.
Yeah, some really great examples there. We've talked about this a bit, but maybe if we could just go into a little bit more detail about some of the biggest challenges right now when it comes to advancing women's health research that you hope to address with this partnership. Regina, maybe starting with you on that one.
Well, I think, and Renee has touched on this before. Look, I think the work that we do at Wellcome Leap is adapted from the model used at the Defense Advanced Research Projects Agency, or DARPA. Now, many people are not familiar with DARPA, but their lives actually know DARPA. So DARPA has perhaps the longest standing track record of radical breakthroughs in human history. For 60 plus years, the agency has been responsible for breakthroughs like the internet, originally the ARPANET, that was a big one, microelectromechanical systems, laser technology, stealth technology. There's a whole list, inclusive of some of the foundational investments in mRNA vaccines. So this particular model is driven by a sense of mission and urgency. And what we do is we conduct all of the work in a project format. So what that means is if you want to get big things done in 3 years, you have to challenge everything about what is typically done. And that means when it would typically take a year plus to evaluate applications, we do it in 30 days. It might take typically months to a year to negotiate a contract. We do that in 30 days. We work globally. We have a sense of agile and iterative development, always focusing on a goal. And in 5 years, we've launched 14 programs. We are working in 30 countries. And I think this is part of what this partnership is recognizing, that sense of urgency in the conduct of the research is partly what is so desperately needed in women's health research.
Renee, would you like to add anything there?
Yeah, and I just kind of reinforce the message that just for too long we've been waiting and women suffer in silence, and that is just not acceptable. And we really, truly, on the timeline piece, see such an opportunity with the idea of breakthroughs on a topic in 3 to 5 years. And I think when you're thinking about the challenges in this space, the challenges include a lack of funding. There is not enough funding or attention to women's health as a space that really deserves its own intentional approach, agenda, strategy, and investment. And we see this as this opportunity to spark more investment, more partnership from philanthropists, from investors, from the industry leaders who share a vision for a healthier, equitable future for women. And I think that is this opportunity, is to bring in more funding to this space, especially in this environment where a lot of funding has been cut for this topic.
Yeah, exactly. And let me give you a sense, Marissa, of what's possible. So in one of our in fact, our first women's health program at Wellcome Leap, the in utero program, which is focused on reducing stillbirth and making advances in maternal care. We haven't had advances in maternal care for about 100 years, right? We still use basically the same tools that we used 100 years ago. And yet in the world, every 16 seconds, a child is born still. That's 2 million babies we lose a year, families, tragedies associated with that. Now, we went very specifically after advances in maternal care with the goal of reducing, basically pointing to reductions in stillbirth by half. And within about 2 years, we had line of sight on a maternal blood test that could, with 80% predictive accuracy, tell us whether a pregnancy was at risk for fetal growth restriction, preeclampsia, or gestational diabetes as early as 12 weeks in the pregnancy. Now, we have never had those kind of tools before in maternal care. That's what's possible using this kind of approach, focusing it on women's health research and applying the kind of research and engagement urgency that's needed for these topics.
Yeah, thank you so much for sharing that. That's a really great example. Renee, bringing it back to you, talk a little bit about why you chose Wellcome Leap as a partner. Can you go into a little bit more detail on that?
Yeah, so I'll just zoom out a little bit. So Pivotal has this mission to advance women's power and influence. And we truly believe that you cannot have power and influence if you don't have your health. And these two things are inextricably linked. So when we think about funding in this way, building on Melinda's, decades of investment in this space and leadership in this space, we've been thinking about in 2024, we funded something called the Action for Women's Health, which was really funding community-driven ideas, advocacy for policy change, groups working on the ground to support women's mental and physical health. And that's really all about lifting up these ideas and solutions that are underfunded. We've also funded 12 global leaders who are each overseeing $20 million for innovative work in women's health and well-being around the world. From Nigeria, we have global leaders in the United States. And then we see this as part of a really focus on innovation and this idea that we have these existing solutions, but what doesn't exist? And really being able to partner with Regina to look out into the future and imagine a different future, that is why we truly were interested in what this approach was, her specific methodology of how they do it, and the rigor in their strategy and agenda. So that is kind of the crux of why we partnered with them.
Yeah, well said. And Regina, bringing it back to you, on the flip side, why did you choose to partner with Pivotal Ventures?
Well, I think we share a sense that it's time. Women have waited long enough. And we definitely need to make advances across the board in care. But as Renee said, we have chasms of gaps in our understanding of women's health. And that is the result of decades of underinvestment in a research devoted to the advances they need to live healthy and productive lives. And we've just got to change that, right? It is not about creating breakthroughs for women is not a matter of chance, it's a matter of choice. And so we're choosing to invest accordingly.
Yeah, and going off of that, I really just have one last question for the both of you. How will you track the success of this investment, and do you have any plans for future investment? Regina, I'll bring that back to you.
Well, I mean, we have, as Renee mentioned, we have a lot of rigor in how we conduct the programs. It's a very high touch process. It's best in class, agile, iterative, always tracking towards a goal, but with, at the same time, the kind of risk appetite needed to generate the kind of breakthroughs that we're talking about here. So when we think about it, we actually start every program with the end goal in mind. So if we don't have a sense of what impact we're trying to create with a bold goal that is also testable and measurable, we don't start. So what we are doing through the conduct of the program is we are watching and tracking and doing the adjustments needed to get to the end goal. So stay tuned for the specifics on cardiovascular and autoimmune, but I can give you a sense from the prior programs of what that looks like. So in the case of in utero, can we generate the advances necessary to show we could reduce stillbirths by half? In the case of our program devoted to Alzheimer's, can we reduce Alzheimer's risk for women, for 330 million women globally? Can we reduce their risk by half so that it isn't true that 2 out of every 3 of our Alzheimer's patients are women? The risk is double that for women as it is for men. And in the case of our Missed Vital Sign program, which is devoted to heavy menstrual bleeding, can we actually get diagnosis and treatment from 5 years down to 5 months? So it's those kinds of activities that we are tracking towards the goal of each of those programs.
Great. Renee, would you like to add something there?
I would say that for us, tracking success is, I mean, this is a bold vision. This has not been tried before. And it is, do we have a breakthrough on these topics in 3 to 5 years? Do we have people who are seeing and kind of coming together as funders around this vision? And I would also say success is lifting up someone like Regina in terms of her leadership and vision, and shining a light on that for others, because that is how we partner and we see philanthropy is taking these investments in leaders that we truly believe in, and we share their vision, we share their values, and we want to support them and back them. And that is an example of women's power and influence, and Regina embodies that in spades. And so part of it is really just shining a light on that, in addition to these ideas that we're going to have these breakthroughs. That is success. And also, if you don't have the breakthrough, we have invested in this space. We took a chance. That is the role of philanthropy, is to make a bet, take a big bet on something you believe in. And that is how philanthropy can push progress and social progress for all.
Well,
Yeah.
Renee, I will tell you that I am humbled and grateful for your confidence in me personally, and also in Wellcome Leap. And I think Renee is correct. You know, when we are taking these big swings, not every program is going to be successful. But even if we have success in a limited number of them, we will change the future for women.
Yeah, that is such a great way to look at it. Well, this has been such an interesting conversation. Thank you both so much for joining, and best of luck on your partnership and your commitment. Really appreciate it.
Thank you so much.
Thank you.